Welcome to the edition of the DAMY vlog. My name is Dr. David Duizer. Thank you so much for tuning in. I'm a naturopathic doctor with a focus on the holistic management of chronic disease. In my clinic here, we practice naturopathic medicine and we use a lot of orthomolecular therapy, which is the topic for today's video. Orthomolecular therapy really means to use vitamins and minerals as therapeutic intervention. And today I want to share a very quick, very small trial that I really love about magnesium and depression. One of the main reasons people come to see integrative practitioners or naturopathic doctors in general is for help with anxiety and depression, for help with mood stabilization, to help to feel better mentally and emotionally. You know, when you sit down with a naturopathic doctor or an integrative doctor in general, you really get one-on-one individualized care. You get someone who will listen to you, who has a medical background, who knows about the medications you're taking, knows about the certain things in your lifestyle that could be affecting your mood, knows about counseling techniques and other types of therapeutic intervention for depression and anxiety, and you get someone who can organize all of this for you and build a proper plan so that you can move forward and feel good mentally and emotionally in usually a short time. In mild and moderate depression, there are so many therapies that can provide significant benefit. Some of them lifestyle, some of them herbal, some of them supplement, including orthomolecular therapies like vitamins and minerals. Today I just want to talk about one really simple one. It's magnesium therapy. And the reason I want to speak about this is because there was a small trial published in a very popular journal and well-respected journal of 112 patients who have been diagnosed with mild and moderate depression. And I'll link to the, it's an open source article, I'll link to it below. And in this trial, they had one simple job: take 248 milligrams of elemental magnesium per day and track how they feel. They were tracked how they felt over 6 weeks through phone follow-ups. And they used the Patient Health Questionnaire 9, which is a validated tool for depression assessment. And they just filled in their scores as they move forward. Now, it wasn't placebo-controlled. It was an intervention trial just to see if there was any benefit by taking the vitamin. So what they found was the average score on the depression scale that they used went down by 6 over 6 weeks just by taking this very small amount of magnesium over this period of time. Now, I should mention, depression has been associated with low levels of magnesium. So they had an idea going in. The researchers thought, okay, this might work. If we take those levels up in people who have been diagnosed with depression, we should see an impact. And my goodness, they did. When this score goes down by 5 points, when someone has taken a medication, that's a note of medication success. Continue with that medication at this dose, it's successful. Well, guess what? Over 6 weeks with the magnesium therapy, the score went down by 6 points on average. Boom. So we know that magnesium therapy was effective for this mild and moderate depression, these mild and moderate depression cases. And we're not talking about a tiny study of just a few people. We're talking about over 100 people. And over a very short period of time, I started noticing benefit right at that first call, right at that 2-week mark. Now, the benefit improved over 6 weeks and reached an excellent point at that 6-week mark. When they stopped the therapy, I believe the benefit went away. So you have to keep taking the magnesium, however. Now, what else happened in this study? Well, they were taking magnesium, so there was a few other benefits that occurred. These people had, the ones who were constipated were no longer constipated. The ones who had muscle cramps, those muscle cramps went away. They noticed a reduction in anxiety of about 4.5 points on an anxiety scale, which was also considered a great reduction in anxiety level. Now, those are all excellent news. They had a reduction in headaches as well, which is great. There were some negatives. Some people were prone to diarrhea, had some diarrhea because they used magnesium chloride. In naturopathic medicine, we use a different type of magnesium, usually in depression, to reach that level of elemental magnesium that was noted in the study, which is about 250 milligrams. But we usually would use bisglycinate or some other types, but not citrate or magnesium chloride. So anyways, some people had diarrhea in this study. But so it wasn't all perfect, but overall, if it were a medication they were assessing, they would say this is a huge success. greater than a 5-point reduction. Boom, boom, boom. Let's go. This is great. In this study, 6-point reduction, really, really great, plus some added benefits of muscle function reduction, anxiety reduction, some reduction in headaches, improved sleep, and bowel movement improvements in those who had constipation. So I really like that aspect as well. So orthomolecular therapy can be great. Of course, in my clinic, we do a lot of this type of therapy. We do IV vitamins and minerals as well. But on the standard, on the prescribing of orthomolecular therapy, I'm not the type of person to just give everyone a multivitamin. I don't think it's appropriate. In fact, I think something that people aren't normally familiar with is that calcium and vitamin E should be avoided in men. Men, please don't take a multivitamin if you're not sure. Consult with someone about it, because vitamins often can be a waste of time and money when they're not appropriately used. So just don't take any vitamin off the shelf, okay? And men, please don't take calcium and vitamin E if you haven't been prescribed it by your primary care provider. So, but individually, nutrients can be really, really helpful. We do a lot of B12 prescribing in our clinic here. We do a lot of B9 folic acid prescribing. We do a lot of B6 prescribing. We do a lot of calcium prescribing for women. We do a lot of vitamin D prescribing, because I'm in Canada here and people's levels are normally pretty low. We do a lot of magnesium prescribing because it seems to be low in the food that we're consuming now, and people notice the benefit really, really quickly when it's used properly. So this is just another one of those cases where it can be used and it seems to be effective and considered safe. And so I really, really like magnesium therapy for many reasons. Mild and moderate depression is one of the good places where it can be used. Thank you so much for watching. If you like holistic health and wellness videos, if you're interested in little tidbits like this to maybe try to improve your overall wellness and just optimize your health so that you are functioning at the highest capacity you can, please subscribe to my channel. I'm doing more videos like this one. If you have a nutrient or a study that you'd like reviewed that is based on a certain nutrient, please let me know and I'll review it for you and give you the details on this channel. Thanks for watching and have a great day.